Hello everyone, this is Major General Al Rosende, the Commanding General of the 63rd Readiness Division, and today we're going to talk about some rules on how to argue safely. So we're going to talk about some key rules to help us get through these friction points with our loved one. And with me to talk about it is Chaplain Siebold.
This is a good opportunity, especially if you're not used to communicating as a family. When you sit down to dinner or whichever meal you choose, to give each person in the family a chance to talk. Maybe they are feeling stressed, or maybe, just ask them how your day went, or what was significant for you today. I've seen traditions like that, where everyone goes around and has a say, and there's a rule where no one speaks until that individual is finished. So no interrupting, you have to wait and let that person have the floor, which is a good speaker-listener technique, which we want to incorporate into our relationships. Learning how to, a speaker-listener technique is based on, basically, learning how to listen really well as waiting your turn to speak. And then when you have your turn to speak, the other person has to learn to listen and to give you the floor. And I think as a family, since we have all this time together, that'd be a really good time, especially at dinner, when you finished your day and you actually have something to talk about, to do that. Now, it would not be a place where you would bring in, maybe you have grievances, or you have, you can say, I got upset today, or I got my feelings hurt, but it's not the place to have the argument.
Right.
Right? And there are rules for arguing too. We want people to stay safe and recognize when communication is no longer safe. Right? So when the communication escalates to a place where you become physical, then the communication is no longer safe. So there are rules: no physical contact when you're having a communication, whether with your spouse or with your kids. If it's coming to a place where you want to get physical, then you probably need to stop the communicating and step away, because then it's going to become unsafe. And then it's not just physical too. Sometimes it's also verbal.
Right, verbal, emotional.
If you're going to get to a place.
I touched my face, so I'm gonna.
Even at the dinner table, where it's verbally hurtful, where you're attacking verbally, then that is also one of those no-nos in communication where you want to stop, because then it's no longer a safe communication, it becomes hurtful.
Sure.
And so those are the two areas where you want to kind of stop.
Can you think of some sort of a technique or a game or something that we can practice to improve our ability to communicate to the folks that we share our household with, that will help us get started if some of us haven't developed those skills yet? Where could we get started?
Well, usually we use this technique a lot, especially when we do couples.
Okay. But it works with kids and families, right?
It works with kids too. We do it also and it's a technique that was developed, I don't know exactly who developed it, but it's used by a lot of therapists when they're doing therapy in families, whether you're doing it with couples, whether you're doing it with individuals. And what's really kind of interesting is kids probably like it, because you can pick something that's fun to hold when you're doing this, and whoever's holding whatever it is, a spatula or whatever they choose to hold, they have the floor. And until they pass it on to someone else, they get to speak. But there are rules, limit your conversation to maybe 5 minutes per person, and then hand it off to someone else so that they can speak. No interrupting, listen, and then repeat back. Like if you're in a family environment, that's the time when you can say, hey, is this what you meant when you said that? You repeat back what they said so that you're clear. And if it's not clear, then that individual will say, no, that's not what I meant. This is what I meant.
Right.
So they can clarify it. Those are some little techniques that you can use, especially when you're talking as a couple. Once that person ceases their conversation, you repeat back what you think they said to you. And then another, this is biological, where if you're having a communication and then they've pushed a button where you're starting to get a little angry, right?
Mhm.
And your blood pressure's starting to rise and your heart rate's starting to rise. And they know medically that if your heart rate gets up to like 100 beats per minute,
Mhm.
then you're starting to go into, some people, stop talking altogether. Some
Mhm.
people kind of go into a shell. Some people put up walls.
Mhm.
They go into like a protective mode, right?
Okay.
And they can't really hear anymore. They can't hear you. And that's when you usually see couples who are escalating,
Mhm.
and they start yelling, and then the other person starts yelling, and all of a sudden it's just a bunch of words, and no one's listening, no one's hearing anything, nothing's really being said because no one's hearing it, no one's taking in the conversation. And so when you get to that point, you really need to stop the conversation. Either go to separate rooms, or you can do what's called a breathing technique, where you actually start to breathe. You put 2 feet on the ground. It's kind of like we practice
Mhm.
sometimes when we're doing our sessions. And you actually take deep breaths and you just start breathing
Mhm.
to lower that heart rate. And then you have to decide, are you the type of person that can now, after you've lowered your heart rate, can I go into that conversation again? Or do I need to step out of the room for a while and then come back into this conversation at another time, so that I'm not angry, or I'm not coming into it.
So the technique that you mentioned, so this technique is a technique to help foster improved communication between a couple,
Between a couple,
or
anybody
among a family.
Among a family, anyone can use it. Actually, you could use it in a boardroom.
And so what quickly are the rules set for this? What is the rules?
We'll
set?
read the rules. The
Okay.
rules are, I need my glasses.
That's okay.
How about you read the rules?
Oh my goodness, I'm playing trombone here. Okay, rules for the speaker.
Yeah.
Speak for yourself. Don't mind read.
All right.
Keep statements brief. Don't go on and on. I would be terrible at this already.
Yeah.
Stop to let the listener paraphrase.
Right.
In other words, when I paraphrase and you're speaking, I'm interpreting what you said, putting it into my own words, and then asking you back, this is what I heard. Is this what you meant?
Yes.
That's what that
Yes.
technique is for, right?
And then if it wasn't, I will clarify and try to help you understand what I actually said.
So that was a rule for the speaker. In other words, stop to let the listener paraphrase.
Once I am as a speaker, I'm finished. Okay, I'm done. Then you, as the listener, will paraphrase or tell me what you think I said to you.
Right.
If it's not correct, then I will try to correct it. And then you will say back to me, okay, then this is what you meant. And if you get it right, I'll say, yes, that's what I was saying.
Okay.
Now it's your turn to speak.
Right. So
What are the rules for the...
So again, the rules for the speaker were those three: speak for yourself, don't mind read, keep statements brief, don't go on, and stop to let the listener
Right.
paraphrase.
So basically, the most important on that, the two most important on that is speak for yourself, right?
Mm-hmm.
Speak for what you're feeling, not what necessarily what I think you're speaking, right?
Mm-hmm.
And then don't mind read. In other words, don't assume that you know what the listener is thinking.
Okay.
All right? Speak for
That
yourself.
can be a challenge.
Right. Speak for yourself. Speak for yourself first, and in the sense of this is how I'm feeling, this is how I'm perceiving, this is how I'm reacting. It's the I, right?
Right.
I'm not going to go where, I'm not going to go and look at you and say, you're reacting because you feel this way, you think this way,
Right.
you feel. We don't want that. We want you to stay in your own body.
Stay in you.
I want to stay in me, and I want to say, this is how I'm feeling. You can actually say, when this action happens, this is how I'm feeling, and this is how I'm perceiving it, right? I'm not going to try to mind read, because that's when you speak, you're going to tell me. I don't need to mind read.
Right. And so then this is the rules for the listener. So you're the speaker right now, and you're
Right.
going through those three rule sets that we talked about. And then as the listener, I'm going to paraphrase what I heard that you said, and I'm going to focus on your message. I'm not going to rebut you. So I'm not going to
Right.
sit there and try to, negotiate, not even negotiate. I'm not going to argue with you.
Right.
I'm going to sit down and paraphrase exactly what you said. and stay to that. Stick to that.
And you know why that's important?
Why?
Because when you're in the lockdown, right, you're not always going to agree with the other person.
Right.
But that's okay. You don't have to agree with someone to communicate with someone, right?
That's true.
That's why that's important. It's not, the communication isn't for you to win the battle.
Mm-hmm.
The communication is for you to understand. I need to understand why you're doing what you're doing and you're feeling the way you're feeling, and you need to understand why I'm doing what I'm doing and I'm feeling the way I'm feeling,
Mm-hmm.
so that we understand when the toothpaste, we'll bring the toothpaste in, when I squeeze the toothpaste in the middle of the toothpaste, why that would bother you. And so next time I go to squeeze the middle of the toothpaste, I will think, I know this really bothers him, so I'm not going to do it.
Or you're going to think, shouldn't bother him anyway.
It
I'll
shouldn't
squeeze
bother
from
him.
the middle.
Yeah.